When should you worry about what's under your toenail? Most people look at their toenails and see nothing more than something to trim and polish. But what if I told you that dark spot under your toenail can be a melanoma? What if that thick yellow nail isn't fungus, but a sign of serious circulation problems? What if those little dents in your nail are your body's way of warning you about an autoimmune disease? My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas. In my 25 years of practice, I've diagnosed everything from life-threatening melanomas to early signs of heart disease, all by examining patients' toenails. Not every dark spot or thick nail is harmless. Some toenail changes are your body's early warning system, trying to tell you that something serious is happening internally. Today, we're going to talk about 7 warning signs you can absolutely not ignore. This is the final video in our Toenail Health 101 series, and it might be the most important one you ever watch. By the end of this video, you'll know exactly when a toenail change requires immediate medical attention and when waiting could be dangerous. But first, if you want to learn how to recognize serious health problems before they become life-threatening, hit the subscribe button and ring the notification bell. I share critical health information every week that could literally save your life. Also follow me on social media. The links are in the description. I've written a comprehensive book about toenail health that includes detailed information about serious conditions that can first appear in the toenails. You can get it absolutely free at www.mytoenailbook.com. The link is right there in the description below. Let's start with the most serious warning sign, one that can literally save your life if you recognize it early. Warning sign number 1, dark streaks or spots that don't grow out. Subungual melanoma, melanoma under the toenail, is rare, but it's also one of the most deadly forms of skin cancer because it's often misdiagnosed or ignored until it's too late. Here's what you need to look for: a dark brown or black streak that runs from the base of your nail to the tip. Unlike trauma-related discoloration, this streak does not move as your nail grows. Instead, it may get wider over time. There are other warning signs of nail melanoma that you should never ignore. Darkening of the skin around the nail, what we call Hutchinson's sign, is particularly concerning. You may also notice splitting or cracking of the nail over the darkened area, drainage or bleeding from the nail, or pain or tenderness that doesn't resolve with time. Here's the critical difference. If you remember injuring your toe and the dark spot appeared after the injury, it's probably just dried blood under the nail. But if you have no memory of trauma, or the dark area doesn't grow out with the nail over several months, you need a biopsy immediately. I've diagnosed several melanomas over the years, and the patients who did well were the ones who came in early when they noticed something wasn't right. The ones who waited, thinking it was just a bruise, had more serious outcomes. Don't take chances with dark spots under your nails. It's better to have peace of mind with your simple biopsy than to risk your life by waiting. Warning sign number 2, sudden nail trauma with severe pain. Subungual hematoma, blood trapped under the nail, might seem like a minor injury, but it can cause excruciating pain, lead to permanent nail damage if not treated properly. There are several things that can cause the condition. Dropping something heavy on your toe is the most common cause, but kicking a hard object like furniture or a soccer ball can do it too. Athletes often develop subungual hematomas from repetitive impact during running or sports activities. There are specific warning signs that require immediate medical attention. Severe throbbing pain that keeps you awake at night is a clear indicator you need professional treatment. Black or purple discoloration under more than 25% of the nail means there's significant blood accumulation that needs to be drained. If you notice the nail starting to lift away from the nail bed, that's another sign your pressure is building dangerously. Finally, any signs of infection such as increased redness, warmth, or pus formation means you need immediate care. Here's what many people don't realize. I can relieve the pressure immediately with a simple painless procedure. I make tiny holes in the nail which allow the trapped blood to drain, which provides instant pain relief and often saves the nail. But timing is critical. If you wait too long, the blood clots and the procedure becomes less effective. If you have severe pain from a toenail injury, don't tough it out. Get it treated within 24 to 48 hours for the best results. Warning sign number 3, nail pitting and ridging. Small dents or pits scattered across your toenail may look like minor cosmetic issues, but they can be the early sign of serious autoimmune diseases. Nail pitting is commonly associated with several serious conditions. Psoriasis affects up to 50% of people who have this autoimmune skin condition, and nail pitting is often one of the first signs. Psoriatic arthritis is a form of joint inflammation that can become crippling if left untreated, and nail changes often appear before joint symptoms. Alopecia areata, which causes autoimmune hair loss, frequently shows up in the nails. Even eczema, a chronic inflammatory skin condition, can cause nail pitting. Horizontal ridges across the nail can indicate different problems. These ridges might signal severe illness or stress that temporarily stops nail growth. Chemotherapy and other powerful medications often cause these horizontal lines. Nutritional deficiencies, particularly protein or zinc deficiency, can create ridging patterns. Circulation problems that affect nail growth can also cause these horizontal lines to appear. Why this matters? The nail changes often appear months or even years before other symptoms of autoimmune diseases. Early diagnosis and treatment can prevent joint damage, control skin symptoms, and dramatically improve quality of life. If you notice multiple small pits in your toenails, especially if you have any skin problems or joint pain, see your doctor for evaluation. Blood tests can often detect autoimmune conditions before they cause serious damage. Warning sign number 4, clubbing of the toenails. Nail clubbing is when your toenails become abnormally curved and the tips of your toenails become enlarged. This is often a sign of serious internal disease. Clubbing is a very distinctive appearance that develops gradually over time. The nails curve downward over a large fingertips or toe tips, create an unusual bulbous appearance. This angle between the nail and cuticle becomes greater than 180 degrees, which is abnormal. The nails appear to float on what looks like a cushion of tissue. Most notably, the tips of the toes become bulbous and enlarged, giving them drumstick-like appearances. There are several serious conditions associated with nail clubbing that requires immediate medical attention. Heart disease is a major cause, especially congenital heart defects or heart failure that affects oxygen circulation. Lung disease, including lung cancer, COPD, or pulmonary fibrosis, often presents with clubbing as an early sign. Liver disease, such as cirrhosis or chronic hepatitis, can cause clubbing to develop. Even gastrointestinal disorders like inflammatory bowel disease or celiac disease can manifest with nail clubbing. Clubbing develops slowly over months or years, so people often don't notice it themselves. Family members or healthcare providers are usually the first to spot it, but it's a significant warning sign that shouldn't be ignored. While clubbing can occasionally be hereditary and benign, it's much more commonly associated with internal serious disease. If you notice your toenails becoming increasingly curved or your toe tips enlarging, see your primary care physician immediately for a complete evaluation. Warning sign number 5, thick, discolored nails that aren't fungus. Not all thick, yellow, or discolored toenails are caused by fungus. Sometimes they're a sign of circulation problems, diabetes complications, or other serious conditions. There are several non-fungal causes of nail thickening that you should be aware of. Peripheral arterial disease, which causes poor circulation to the feet, often results in slow-growing nails. Diabetes complications, especially neuropathy and vascular disease, can cause significant nail changes that mimic fungal infections. Psoriasis can cause severe nail thickening and discoloration that's often mistaken for fungus. Lichen planus, an autoimmune condition affecting nail and skin changes, creates distinctive nail changes. Even chronic trauma from ill-fitting shoes or repetitive injury can cause nails to thicken and discolor over time. How to tell the difference? Fungal infections usually start at the tip or edge of the nail and gradually spread towards the base. They often have a chalky, powdery appearance underneath the nail and may have a musty odor that's quite distinctive. Non-fungal thickening often affects multiple nails symmetrically, meaning both feet are affected in similar patterns. This type of thickening may be associated with skin changes on the legs or feet, such as shiny, hairless skin or poor wound healing. Most importantly, non-fungal nail thickening doesn't respond to antifungal treatments, which is often how we make the diagnosis. Why proper diagnosis matters: If you have circulation problems causing nail changes, you're at high risk for serious complications like non-healing wounds, infections, and even amputation. Early diagnosis and treatment of the underlying conditions can prevent these devastating outcomes. Warning sign number 6, nails separating from the nail bed. Onycholysis, which is when the nail separates from the nail bed, can be a sign of thyroid disease, psoriasis, or reaction to medication. These conditions have a distinctive appearance that's easy to recognize once you know what to look for. You'll see a white or yellowish area under the nail where it's separated from the underlying skin. The nail may appear to be lifting away from the skin, creating a gap that wasn't there before. The separation usually starts at the tip and progresses towards the base of the nail over time. This condition may affect one nail or multiple nails, depending on the underlying cause. There are several common causes of nail separation that range from benign to serious. Thyroid disorders, both overactive and underactive thyroid conditions, commonly cause nail separation. Psoriasis can cause onycholysis, especially when it's combined with pitting or ridging of the nails. Medication reactions are another common cause, particularly with antibiotics, chemotherapy drugs, or antimalarial medications. Fungal infections can cause separations, though it usually occurs with other symptoms like thickening or discoloration. Sometimes trauma from aggressive manicures or injury can cause the nail to separate from bed. When to worry. If your multiple nails are separating without obvious trauma, or the separation is accompanied by other symptoms like fatigue, weight changes, skin problems, or joint pain, you need medical evaluation. Thyroid disorders are particularly important to diagnose early because they affect every system in your body that can cause serious complications if left untreated. Heart problems, bone loss, and mental health issues can all result from untreated thyroid disease. Warning sign number 7, sudden changes during medical treatment. Chemotherapy and other medications can cause dramatic changes to your toenails that require careful monitoring and immediate attention when problems arise. Chemotherapy-related nail changes can be quite dramatic and concerning. Severe discoloration is common, with the nails turning black, brown, blue, purple, or even green color. Horizontal ridges often appear that mark each treatment cycle, creating a timeline of your treatment on your nails. Extreme brittleness and breaking can make your nails painful and difficult to manage. In severe cases, complete nail loss can occur, leaving the nail bed exposed and vulnerable. Most concerning is the increased risk of infection around the nails due to the suppressed immune system. Why this matters. Chemotherapy suppresses your immune system, making you extremely vulnerable to infection, and what would be a minor nail problem in a healthy person can become a life-threatening infection in someone undergoing cancer treatment. There are specific red flags during chemotherapy that require immediate medical attention. Any sign of infection, including redness, swelling, warmth, or pus, should be treated as medical emergencies. Ingrown toenails, even minor ones, can quickly become serious infections in immunocompromised patients. Cuts or breaks in the skin around the nails create entry points for the dangerous bacteria. Unusual pain or tenderness that develops suddenly should never be ignored. Don't ignore nail changes during cancer treatment. Your oncologist needs to know about any problems. You should see a podiatrist immediately for any concerning symptoms. Let me share a case study that illustrates why these warning signs matter and why early action can literally save your life. I had a patient, let's call her Susan, who came to my office concerned about a dark streak in her big toenail. She said it had been there for about 6 months and seemed to be getting slightly wider over time. Susan couldn't remember any injury to her toe, and the streak wasn't growing out with the nail like you would expect it from trauma. The streak was getting wider and darker, which were concerning signs. I immediately recommended a biopsy, even though Susan was hesitant because it didn't hurt. It seemed like such a small thing. The biopsy revealed early-stage melanoma. Because we caught it early, Susan only needed minor surgery to remove the affected tissue. Her prognosis is excellent, and she's now several years cancer-free. But here's the scary part. Susan almost didn't come in. She had mentioned the dark streak to her primary care doctor 6 months earlier, and he told her it was probably just a bruise and to keep an eye on it. 6 months of delay could have been the difference between life and death. That's why I'm so passionate about educating people to recognize these warning signs and seek appropriate care immediately. When should you seek immediate medical attention? There are specific situations where you need to see a podiatrist or a dermatologist immediately without delay. Any dark streak or spot you can't explain with recent trauma needs immediate evaluation. Severe pain from a toenail injury, especially if it keeps you awake at night, requires urgent care. Signs of infection include redness, swelling, warmth, pus, or red streaking up your leg are medical emergencies. Multiple nail changes at the same time suggest systemic problems that need investigation. Nails separating from the nail bed without obvious cause can indicate serious underlying conditions. There are also situations where you should see your primary care physician promptly for evaluation. Nail clubbing or enlargement of toe tips can indicate serious heart, lung, or liver problems. Multiple pitted nails, especially when combined with skin or joint problems, may signal autoimmune diseases. Nail changes during medical treatment, particularly chemotherapy, need to be reported to your medical team immediately. Any nail changes combined with other symptoms like fatigue, weight loss, or skin problems should be evaluated comprehensively. What you can expect during an evaluation when you come to my office: I take a detailed history about when the changes start, any associated symptoms, medications you're taking, and your overall health status. This information helps me understand the context of your nail changes. I perform a thorough examination of not just your nails, but of your entire foot and lower leg, looking for signs of circulation problems, skin changes, or other abnormalities that might explain the nail changes. If necessary, I'll take samples for laboratory testing to get a definitive diagnosis. This might include fungal cultures to rule out infection, nail biopsies if there's a concern about melanoma, or other serious conditions or bacterial cultures. I might refer to other specialists if the nail changes suggest systemic disease. This could include dermatologists for skin conditions, cardiologists for heart problems, endocrinologists for thyroid or diabetes issues, and oncologists if there's a concern about cancer. Prevention and monitoring strategies include performing a monthly self-examination of your toenails as part of your regular health routine. Look carefully for changes in color, thickness, and texture and that develop over time. Watch for any new streaks, spots, or discoloration that can't be explained by recent trauma. Notice change in nail shape or curvature that develops gradually. Check for separation of the nail from any nail bed or any gaps that weren't there before. Always look for signs of infection or inflammation around the nail border. Take photos of any concerning changes so you can track whether they're getting better or worse over time. This documentation can be very helpful for your healthcare provider. Keep a health diary noting when nail changes occur in relation to illnesses, medications, or other health events. This can help identify patterns and causes. Don't ignore family history of nail problems, skin cancer, or autoimmune diseases. Many conditions that affect nails have genetic components that increase your risk. The bottom line: your toenails are a window into your overall health. Changes in your nails can be the first sign of serious internal diseases, and recognizing these changes can literally save your life. Don't dismiss nail changes as just cosmetic. When many nail problems are indeed minor, some are early warning signs of conditions that require immediate treatment. When in doubt, get it checked out. It's always better to have a professional evaluation and peace of mind than to ignore something that could be serious. The cost of an evaluation is nothing compared to the cost of missing a serious diagnosis. If you found this series helpful, please hit that like button and share these videos with your friends and family. This information could help someone recognize a serious condition early and potentially save their life. Subscribe to the channel and follow me on social media for more life-saving health information. These links are in the description. Don't forget to get your free copy of my toenail health book at www.mytoenailbook.com. It contains detailed information about all the conditions we discussed in this series. I want to hear from you. Comment below and tell me, what's the weirdest thing you ever noticed on your toenail? Your experience might help viewers recognize important warning signs. If you've noticed any of the warning signs we discussed today, don't wait. Contact our office for an evaluation. Early diagnosis and treatment can make all the difference in your outcome. The link to schedule is in the description below. Remember, your toenails are trying to tell you something. The question is, are you listening? Thanks so much for watching, and have a great day.